Hi!
Hello, this is Dr. Vijay Kumar, Chennamchetty, Senior Pulmonologist. In one of our earlier videos, we have discussed about what are the non-surgical or purely medical and exercise-based management of COPD. But today, now we are going to discuss about what are the non-medical options. The non-medical options include what you must understand before we head on to the treatment is in COPD or in emphysema predominant COPD, what happens is your lung elasticity is lost and your lung overall capacity will be decreased or compromised. So, how to manage such things? In the modern world, there are few methods like bronchoscopy, that is endoscopy methods. There are few surgical methods, but if everything else fails, then you are now left over with a method called lung transplantation. So, my dear friends, so when you look at the bronchoscopic methods of managing COPD, there are various things. There are a lot of research happening across the globe. So, what is available across the globe when we see there are coils available, there are valves available, what we call endobronchial coils and endobronchial valves, and endobronchial thermal vapor ablation technique. In overall, what happens is in all these things, so essentially the hyperinflation, what we call, there is a lot of air that is get trapped in the lungs of COPD and emphysema patients. In this hyperinflation, the lung entrapment will be released so that the height of the lungs will be slightly decreased with these various methods. To be honest, the valves and coils are not available in our subcontinent, but the thermal vapor ablation is available. But just to remind you, this is also in very nascent stage, in research phase only. Whereas coming to the surgical management of COPD includes a lot of, there may be bulle, that means lot of air pockets in the lungs which can be cut open and then taken out so that the pressure effect in the chest will be released so that the quality of life and the breathing difficulty will be decreased. So nowadays, with the advances in surgical techniques, these surgeries can be performed with VATS. What is VATS? VATS is nothing but thoracoscopic management. That means they don't cut open the chest. They just put one or two holes and they manage through these holes the entire surgery. And the next day, patient will start walking. And if all these measures are not useful for you, or if there is a lot of issues pending after management with all these surgical options, then we will direct you to lung transplantation team, where a single lung can be transplanted or both lungs can be transplanted. Sometimes in very severe cases, heart lung transplantation will also be offered. So these are the various methods, both bronchoscopic, thoracoscopic and transplantation methods to offer you in manage your COPD in the best forms when you are not responding to your conventional medical therapy and pulmonary rehabilitation. Thank you.